Hey everybody, we're Instagram living. I'm here with Kristi Cashman, who is one of our non-invasive body contouring experts. And we thought we'd talk about our upcoming trip. So if you come to the side of our clinic, you'll see a little advertisement for it. We're very excited. In April, we're going to be doing body food camp. So Kristi and I thought we would spend a little time talking to you guys on it. So we're going to take a little journey from the main part of clinic over to our area that's dedicated to non-invasive body contouring. So many of you guys have been in the doors of our main clinic, but just over off to our side is actually our body contouring area. And we'll really focus on 3 of the technologies. So we'll talk a little bit about Emsculpt NEO, which has really become one of our gold standards.
Oh my gosh, fabulous for muscle toning, great for getting your summer confidence going.
And there's so many areas that we can treat that. So this combines 2 technologies. It's radiofrequency, which creates some warmth so that our muscle training is a little better, but it also helps with fat reduction. And then the second technology is HIFEM, which is high intensity focused electromagnetic energy, and it helps with involuntarily contracting our muscles. So if you look at the clinical studies, of which there's been multiple ones in multiple areas of the body published, we uniformly get about 30% fat reduction, about a 25% gain in muscle mass. And if you're wanting to do like a mini mom makeover and have a little bit of diastasis recti, we've shown in imaging studies it actually helps to lessen some of that width between our rectus abdominis muscles. So one of the other ones we'll be talking about is yours, like the guru.
This is one of my favorite treatments for reducing excess volume in targeted areas. So it really helps to actually sculpt and contour your body. So we use, a lot of times we use this in conjunction with this to get a fabulous result. Just contouring, getting rid of excess volume, but then also kind of pulling all those muscles together to get a nice little cinch.
And we'll talk about, because it's kind of loud out here, so we won't spend a ton of time out here. We'll go inside and talk some more, but I want Kristi to talk about her expertise in Coolsculpting. And then finally, something that we've been doing a ton on in patients is EMface.
Yeah.
So this is kind of like the cousin treatment to Emsculpt NEO. It combines radiofrequency, which heats the skin, helps with collagen and elastin production. But these pads that are treated on the forehead and the 2 cheeks also train our muscle groups. We'll talk inside about what exactly that does. And we're very excited because we're combining that a lot with some of our injectable technologies and some of the other things we do on the face to really sculpt the face. So we'll come into the first room, and I think with Kristi, I would love for her to talk a little bit about Coolsculpting and some of her background.
Yes. So Coolsculpting is basically, it's cryolipolysis, which is freezing fatty tissue so that your body actually takes over and eliminates it. So we are absolutely able to target little pockets of fat. So we are able to do 9 different body areas, FDA approved body areas. I've been doing body contouring for about a decade now, and actually am also an Allegan Medical Institute Coolsculpting trainer. So I travel around training other people how to do Coolsculpting. It's one of my favorite things to do. I absolutely love educating our patients as well as educating other people to do Coolsculpting.
And I think what is so powerful, I mean, this really is one of the gold standards of non-invasive ways of removing fat. So this is the freezing of the fat, cryolipolysis. There's been over 100 published studies on this. We know it's a very safe treatment. I think advantages at Art of Skin MD is we've got 2 machines. So many times we're treating 2 different areas.
Absolutely.
So if we're treating both arms, we can do that at the same time. You're not sitting and treating one side and then you have to wait and sit through another session. We can do that simultaneously. I think, Kristi is very humble about this. So, she is one of the instructors for Coolsculpting Academy. So she is the educator that when people are introducing this into their practice, she's actually training people on best practices. So I think we have a real emphasis on safety and effectiveness and cutting edge technology. So I think the fact that we have such a person with such educational lineage and is an instructor themselves, you guys all know that I do a ton of educating and I lecture at meetings. Well, Kristi's doing the same thing in her area. So I think, in terms of results, we usually recommend at least a couple of cycles, depending on the area we're treating. It's usually 4 to 8 weeks apart. You could have some mild numbness in the area of treatment. I tell patients, I've had Coolsculpting myself. I've had it in my inner thighs. I've had it on my lower abdomen. I had really nice results from it. A little bit numb for several weeks, and then immediately after treatment, there's a rewarming of the tissues. We do some massage. That's the most challenging part. I tell patients 3 to 5 minutes is definitely spicy.
Steamy,
but after that, really easy, very consistent results. So I think we usually tell patients any single treatment will give you about 15 to 20% fat reduction. That's why we usually recommend at least 2, but doing a series of treatments, you yield better results.
Absolutely. Super important also that you don't see your final result until about 3 months after your final treatment. So now is the time to get in for consults and treatments if you want to get your summer confidence boosted. So,
and we're going to be running some nice specials with Body Boot Camp. So we've been starting to put up some ads for that. We'll have a blog entry in April that goes over that. It's running the first couple of weeks of April. It's a great time. Bikini season is going to be around the corner. So if you're trying to think about summer body, getting yourself in shape, need a little bit of extra help, I think this is a nice technology to be able to do that, and a good standard one.
Super reliable. Love it.
We'll go to our other room because we want to talk about some of the other technology that we have. So in this room, maybe you want to introduce what this is.
So this is our Emsculpt NEO. This is what we use for muscle toning and also targeted fat reduction. We can use it on several different areas. We have several different applicators, including the brand new applicator, the Edge, which we're using for sculpting the waist and flanks. It kind of fits around you like this. It's fabulous for cinching in that little waist and for targeting this little love handle area here of this new applicator. We also treat abs, we can treat booties, we can treat thighs, arms with this, just to help tone those muscles and target a little bit of fat reduction as well.
Yeah, so it's great. We often will use, if somebody comes with an abdomen, they're not a proper candidate for something like the liposculpture, we talk to them about debulking with Coolsculpting first, and then using something like this to enhance further fat reduction and build the muscles, because these machines are able to involuntarily contract the muscle beyond what you can get with the best trainer in the world. So they're causing super maximal contraction. And they're doing so in a way with a series of treatments, usually come in roughly once a week.
Right.
But you can do more. So, we see even better results if people do more, and, you can buy packages of these to sort of maintain the results. We know from clinical studies that you still are maintaining this muscle mass up to 12 months after the initial treatments. But I think our happiest patients, they do the initial series of treatments, and then we periodically, whether it's quarterly or however often they want to do it, do some to maintain things. I know I'm tall, I'm 6'1", and I'm leaning over people all the time. So I actually have my bottom treated and I have my abdomen treated, because those muscle groups work together to keep us upright and keep our upward posture. So, I've had another physician that was having low back pain. We treated her abdominal core muscles, not only for aesthetic outcomes, but for functional outcomes. So I think that's really important. She was having less low back pain when she was running. I know for me, my planks are easier when I'm doing yoga class. My ab workouts are easier when I'm doing this. And I'm not so tired at the end of the day. And we know that there's postural changes we have if we're actually supporting these muscle groups. So beyond aesthetic outcomes, I think we also need to think about function. And we lose muscle mass over time. It's called sarcopenia. And when we lose enough muscle mass, we start to have problems with posture, we have problems with balance. It starts to affect quality of life. So I really think we're at the edge of sort of functional medicine, rehabilitation medicine, and then we get obviously all these nice aesthetic sort of treatments from this as well. So we're really, I think, treating the whole patient and more holistically. So now that you've been introduced to one of the high intensity focused devices with radiofrequency, we want to go back to the face. So we're going to go back to that original room now that we've introduced this kind of combination muscle toning. And then I want to introduce you to our newest device, which is EMface. And I had Kristi delivered 3 treatments to my face in December, and then I had 3 about a month ago, I would
Right.
say. And I was just recently at our national meeting lecturing at the American Academy of Dermatology, and several of my colleagues are like, "What are you doing, Melanie? Because you look really great."
Yes.
And so tell me a little bit
Oh my
about, or
gosh.
tell our audience a little bit about the treatment.
So what the treatment is it's radiofrequency and electrical stimulation of the facial muscles. So you're getting a dual modality. You're getting lift with the electrical stimulation to the muscles. We focus on the forehead and the cheeks, only muscles that actually lift. And patients are seeing, oh my gosh, such a nice improvement in the brow position, some improvement in the contours here on the nasolabial folds and along the jawline, and a little bit of cheek enhancement I'm seeing, which I love, kind of helping out this little tear trough area as well. And then you've got the radio frequency on top of that, which helps with the collagen and elastin, helps stimulate your body's ability to make collagen and elastin. So you actually get textural changes in your skin as well, which we love. Little fine line enhancement.
Yeah,
So.
and so I think this is such a powerful technology. You know, I do a lot of lecturing on injectables, and I think this is really going to, over time, change how we do not only the cadence of our injectables, but how much we do. So some of my patients, you know, we never want to overfill a face.
Right.
We want to use injectables to help with structure and replacement of lost volume over time. But there's, I think, limitations to what that can do. So we're really targeting 4 different muscle groups with this treatment. The pad that's placed on the forehead helps with our frontalis. That's our brow elevator. And what happens with our muscles over our decades in our face is like they start out juicy. Think of like a nice juicy sirloin steak. And then over time, it's almost like they become beef jerky. They become elongated, they lose some of their hydration, and they try to hyperfunction in order to function a little better. So on the forehead, providing some bulk back to this and treating with the radiofrequency at the same time, we've seen softening in the skin texture and improvements of the brow and opening of the eyes.
Yeah,
We're
it's
looking at
just
2
so
before and
much
after some
brighter,
patients,
yes.
and the aperture of the eyes is actually increased. For the cheek, we're targeting 3 different muscles. So we're getting our zygomaticus major and minor. So those are 2 cheek muscles that go from the corner of our mouth up to the apex of our cheekbone. And we're treating a 3rd muscle group called our buccinator. It goes from the corner of our mouth to the middle of our cheek. And they are like the hammocks that hold up the soft tissue in our face. So if they're becoming more elongated and they're not as highly functional over time, if we can do something to rehabilitate that, we see improvement and displacement of volume in the place that it used to be. So we are seeing improvements in the overall contour of the cheek. This is called our OG curve. So this volume that tends to settle here, we're seeing in our patients before and afters, it's getting displaced forward into a more pleasing area. We see improvements in the depth of the nasolabial fold, improvements subtly in the jowl and the jawline. In the studies, they did this once a week, 4 times. What we're recommending for most of our patients is to do 6 of them, and then do periodic maintenance with that. And we're typically seeing patients back 1 or 2 months after treatment and starting to see these results. But for some of my patients that don't need a lot of volume, I will do this first, really get that beautiful sort of V shape back to their face, and then decide how much filler we need. And for our filler patients, for facelift patients, for maintenance, and people that have heaviness in their lower face that they're wanting to pick up, those are really great candidates for this. It's not a facelift, but we've never had something short of surgery to be able to address some of these muscle groups that are really the core structural mid-face muscle groups and our big forehead muscles. So we can use this in conjunction with neuromodulators. It still works. We'll talk to you about that. But I think this is a really innovative treatment. Explain what it feels like to the patient.
You know, patients sit through it really well. The first treatment, usually they feel like it feels a little bit odd. But it's not painful. Nobody says it's painful. It feels warm where we put those little hydrogel pads, and you just feel like, I had one patient explain that it felt like when your great aunt comes and pinches your cheeks really hard. So it makes you smile or kind of grimace. It pulls your muscles this direction and then just raises your brows. So it's a gentle treatment, but and once you get used to it, patients sit through it really, really well. Usually the second treatment is so much easier than the first because they know what to expect. But not a painful treatment. Patients are actually really loving
I think it's just you get involuntary contraction of the muscles. So you
odd.
see yourself sort of smiling,
exactly.
which feels a little funny when you're first doing it. But this is, we were actually the first practice in San Diego to have this. We've been treating patients since late November, early December, and people have been raving about it. It's definitely been a popular reason for consultation in our practice. And speaking of that, we do offer complimentary consultations with Kristi. So if you're, we believe in education. We think that's why we have such happy patients, and the education and you understanding sort of the technology, I think, is really important to the success of our patients. So please come in and ask us questions. We love, questions. There's no silly one, and we love teaching our patients. And then behind you, maybe, do you want to talk a little bit about this device as well?
This actually works really well in conjunction with our EMface. Exilis is radio frequency and ultrasound that we use for skin tightening, maintenance and or skin tightening. Basically, again, it is something that it has a little handpiece that we run over the area that we're wanting to treat, and warms the skin to a temperature that enhances its ability to make more collagen and elastin. So great for fine lines around the eyes. We do a lot of eye treatments since the EMface isn't really addressing, that skin around the eyes. Great for the neck and for the lower face. This, little submental area is fabulous for. It's a series, again, of 4 treatments done about 2 weeks apart. Sometimes I do recommend more treatments. We do recommend maintenance with it and good skincare along with it. But patients see a really nice improvement in fine lines and wrinkles with this.
Yeah, and just to clarify, this is just monopolar radio frequency, so no ultrasound component to it.
Yeah.
But we'll talk to you about if there's any sort of contraindication to treatment. We'll talk to you about who's a good candidate. I tell patients it feels like a hot stone massage. It's not. Neither of these treatments require any sort of topical anesthesia. We will focus at our body event, so we're going to do an Instagram live during that 2-week period where we'll talk about ultrasound technology, because we do have Ultherapy, which is the only FDA approved way of skin lifting with actual real-time visualization, which allows us to tailor a truly bespoke treatment for patients that are wanting sort of lifting of their tissues, whether it's face, neck, or other areas. But we're really excited about this. We definitely have a busy side of clinic over here, and want everybody to be able to share in the best season's offerings in terms of savings that we offer during the year. So
now is a great time to come in for consult also, so that you know what we recommend and are able to purchase the correct packages in the from the Body Boot Camp. So come on in for a consultation and we'll get you all squared away.
Yeah, so our phone lines are off during lunch, but we'll be back at 1 p.m. Pacific Standard Time. Phone number is 858-792-7546, and you can schedule a consultation with Kristi if you're interested in learning more about any of the technologies for face or body that we discussed today. And then we will do an Instagram live in April on the event, and that'll be our Body Boot Camp. I think this is like our 6th annual time that we're actually doing that. So please ask questions. You can give us a call after our lunch hour. You can also look at our website, and that's artofskinmd.com. So thank you guys so much. We wanted to focus a little bit on Kristi and all the offerings we have. Hope you guys have a great week, and let us know if we can help you out.
Come see us.